Hello everybody. Welcome to a video by the New Noise campaign, made to spread awareness of selective mutism. So you may have heard of selective mutism or SM, but what is it? Well, SM is an anxiety disorder where the sufferer, in certain situations, is unable to speak due to anxiety. This can take place in any situation, but one of the most prominent is school. This can be a big challenge for both the sufferer and the staff members trying to help, so in order to make things a bit easier, here are a few tips and tricks to help both yourself and others with selective mutism. Number 1. Understand that SM isn't a choice. SM is an anxiety disorder. It's not necessarily fun to think about, but it's true. It isn't a fun challenge you'd see influencers do. It isn't something to make others' lives harder, and it especially isn't done for attention. It's a mental health issue, one put onto people at birth, and something that, like other disorders, isn't a choice, so you shouldn't treat it like one if you want things to get better. If you are someone without SM, forcing someone with it to speak or give an immediate answer as if they're teasing you can make them freeze and stop communicating altogether, so understand that they need time to get their words out by whichever way works best for them. It is also important to recognize SM as different from other forms of muteness, where the sufferer is mute for reasons other than anxiety, as they require other forms of treatment, or none at all. If you are someone with SM, understand that you are not doing this because of a trend you saw, or because you're just a troublemaker. This is something that is hard for you, and understanding that you haven't done anything wrong can be the first step to improving your health. Number 2. Don't talk down, talk up. If you are unfamiliar with what talking down means, talking down is speaking to someone in a condescending or oversimplified way, as if they were a baby. This can be hurtful to anyone in any situation, but especially those with selective mutism. If you are someone without SM, don't talk to them as if they're stupid, since you wouldn't if they didn't have it. Talk to them as if they were any other person, but maybe talk a bit quieter and calmer if you sense the person is stressed, and assure them that they have nothing to fear. If you are someone with SM, don't talk down to yourself. This will only make you feel worse about yourself and your situation, which doesn't help anyone. Try to think better about yourself and understand that this is a challenge for you, and that while not many others will understand it, it doesn't make you inadequate or mean that something is wrong with you. If you practice talking up instead of down, things will be much easier for you and others. Number 3. Be patient. Like many mental health issues or problems, selective mutism isn't something that can be improved in a day, and understanding that can make your life easier. If you are someone without SM, remember to be patient, and wait for the person to respond in whatever way feels comfortable to them, if at all. Depending on the method of communication, this can take longer than speaking, or not happen at all if their stress levels are too high. If you are someone with SM, communicate with others however feels best to you. You can use a pencil and paper, sign language, texting, any other method you like, or not at all if the situation is too much. If the person can't wait a few extra seconds for you to write something down without getting upset and walking away, they probably aren't worth your time. So find those who are willing to be patient and listen to you, as you might have a lot of interesting things to say if given a proper chance. Number 4. Start small. Speaking in front of others can be a daunting task for those with selective mutism, so it's important to not rush it, as every skill takes time to learn. If you are someone without SM and know the sufferer closely, you may wish to ask them what their current goal is and work towards that. Some goals may include using your full voice instead of a whisper, talking to more than just one person at a time, or mouthing simple words such as yes and no instead of shaking your head. Just be sure not to pressure them into achieving that goal, as it's up to them. If you are someone with SM, encourage yourself to focus on goals either recommended by others or ones you made yourself. Do not rush the process and expect yourself to be completely verbal after a month or two. SM can take months, or in extreme cases, years to conquer, and setting those expectations too high can cause more harm than intended. I can attest to that as someone who went through that myself. Thank you so much for taking time out of your day to learn more about SM and how to help. We hope these tips helped, but if you're still struggling or want to learn more, visit professional websites such as the NHS and ontario.ca. And if you'd like to scan this QR code and take a quick survey on how we did, that would be very much appreciated. We hope to see you again soon, and thanks again for watching.